This conference will now be recorded.
All right, so we'll go ahead and begin here. All right, so just to give you a little bit of background about the Great Plains Colorectal Cancer Task Force. Now, this was started with the Great Plains Tribal Chairman's Health Board whenever we were granted our Great Plains Colorectal Cancer Screening initiative. So the subawardees will participate in the Great Plains Colorectal Cancer Task Force, the GPCCSI TF. So the task force meets quarterly, 4 times each year via webinar. The goals are to engage communities and foster partnerships that will allow organizations and individuals to establish a collaborative approach to increase colorectal cancer screening among Northern Plains American Indians. So by providing education and outreach, the task force will strengthen the community resources and community clinical linkages. This task force prioritizes health behaviors and lifestyles to improve and enhance the quality of life, as well as reduce risk factors associated with for input, advocacy, education, collaboration, planning, and action along the cancer control and chronic disease continuum. I apologize, I got a little bit of a lag on my computer, so if it seems like I'm clicking through, that's the reason why. All right, so this is the agenda that we'll be going over. So we all know that the COVID-19 is a big issue, not only nationwide, but globally. So we'll touch a little bit on that and some of the resources that you could find useful. And also with patients that do have CRC and who pose a threat with the COVID-19. So we'll touch on that as well. Also, CAT Communications, the Turtle Mountain Band of Chippewas Community of the Year, monthly technical assistance correspondence, the Great Plains Colorectal Cancer Screening CRC education resources, project sustainability, which will be presented by Richard and Stella C1 Zimmerman, the Regional Partners in Cancer Symposium, and upcoming webinars in our March awareness campaign. Also, I would like, if anyone has any questions, to save them at the end, and then we'll go ahead and go from there and answer everyone's questions. All right, so one of our resources that I'd like to start off with is with the Great Plains Tribal Chairman's Health Board website. So this is a perfect website because what it does have, it talks about what is the coronavirus disease and how it started, and how can you protect yourself, your family, your community members. What do you do if you're feeling sick? COVID-19 in the Great Plains area region, COVID-19 in the United States and internationally. So this also provides resources for clinics and providers, resources for families, resources for businesses, and questions and contact. If you have any questions, this would be a perfect website to go to. Now, so we do have the link up here, but if you don't remember it or if you forget that it is on the slides, what you can do is just go ahead and go to the Great Plains website. It is www.gptchb.org. And then from there, right on the very first page, you'll see the COVID-19 and learn more. Now, one thing that I do like about this website is that it does highlight. So I don't know if you could see this. It does have the link that you can actually click, and it'll bring you to different types of websites or resources. So if it is highlighted, you can go ahead and click on it, and it'll bring you straight over to there. Now, another resource that I want to touch base on is from our partners with the National Indian Health Board. So for tribal partners and community members to utilize, comes from the National Indian Health Board. Now, the map that you're currently seeing is from a few days ago, and this has dramatically changed. That this highlights the tribal communities with COVID-19. So I looked yesterday and I noticed that the map has significantly spread across the US with numbers. So if you want to get the latest information on COVID-19 in Indian country, be sure to follow the link in the slides, or you can just go to NIHB. And I believe it's NIHB.org. Now, when you do click on this slide, it'll also tell, the confirmed cases and deaths by state, per region, or if you want to just go to your actual state, it'll go ahead and bring you there, and it'll highlight some of those things, kind of give you more of like a geographic look. And it does have information that you can click on with resources that you may need, preventative types of things to keep you and your community safe. All right. So, and then I want to touch on another resource that we do have. So you'll find updated resources and information from the leading organizations such as the Center for Disease Control and Prevention and the World Health Organization, the WHO. So Fight Colorectal Cancer aims to provide tools and support to patients and caregiver community in ways that are most helpful and reassuring to you and your family during this healthcare crisis caused by the rapid spread of the novel coronavirus COVID-19. So unfortunately, coronavirus poses an extra risk for colorectal cancer patients due to the immunosuppressive treatments they receive. As the spread of coronavirus occurs throughout the world, researchers, public health officials, and individuals all play a role in slowing the spread of the virus in order to protect the colon and the rectal cancer patients at large, and any vulnerable population. So Fight CRC compiled information from the World Health Organization, American Society of Clinical Oncology, and the Center for Disease Control about steps to take in an effort to keep you and your community healthy. So stay up to date can easily lead to an anxiety and panic for some. But the good thing is that Fight CRC has also included some information on how to manage that type of anxiety, especially with your cancer patients. And we do have these links highlighted in the slides. And if you would like any more of these resources, you can feel free to reach out to me, and I'll be able to help you out with that. Now, with the very top link that you see, Fight Colorectal Cancer blog cancer and COVID-19 is a different, it'll bring you to a different platform. This will have different types of questions, and it's almost like a Q&A. Now, if you go to the bottom one, this one right here where it says COVID-19 resources, this has a big platform of different types of resources that you can click on in regards to cancer patients and COVID-19. So feel free to check those out, and it'll have up-to-date information. All right. So COVID-19 and CRC screening recommendations. So what else do cancer patients need to know about the coronavirus? So with this site, it contains common questions with cancer patients and COVID-19. CDC recommends healthcare facilities and doctors prioritize urgent and emergency visits and procedures. So avoiding being exposed to this virus is especially important for cancer patients who might be at higher risk for serious illness if they do get infected. So this is particularly true for patients who are getting chemotherapy of stem cell bone marrow transplant, because their immune system can be severely weakened by their treatment. The CDC is recommending that healthcare facilities and doctors, as well as dentists, prioritize urgent and emergency visits and procedures for the coming several weeks, and this may change. So Dr. Len Lynchfield, the Deputy Chief of Medical Officer for the American Cancer Society, says we're ahead of time when there will be significant disruptions in the care of patients with cancer. For some, it may mean a delay in having elective surgery. For others, it may be a delay in preventative care or adjuvant chemotherapy that's meant to keep cancer from returning. You may need to reschedule your appointments. So remember, these screening tests save lives when restrictions lift. It is important to reschedule and any screening test that you're due to receive. And we also kind of explored this realm just in case, if some of our communities can send out the FIT and FOBT testing via email or via mail, but that is to be determined. So I would urge word from CDC and the American Cancer Society on that if facilities do want to do that. And like I said, this is forever changing as the COVID-19 continues. So we'll keep you up to date on those types of things. All right, so let me go ahead and switch lens here. So the focus, so this one's CAT marketing, the GPCCSI CRC month awareness conclusion. So this was for the whole month of March. So we had a collaboration with CAT marketing just to get some of our information to our colorectal cancer patients as well as our facilities, spreading the word through, I think it was Good Health TV. So the talking toilet was the most successful in reaching a total of 143,328 people. And it's this video right here that you'll be able to see on the slides. We did share it on our Facebook page, and I think that's what the numbers are referring to. The second was the digital story of Llewellyn Lunderman, and that was reaching 45,961 people. And then there was other videos that were displayed throughout the month of March, and these are just some of them. The talking circle, Llewellyn's story as well. So there was a total of 848 links. Sorry, I'm getting a little tongue-tied here. Link clicks to the ad. The talking toilet video had the most posts engaged at 153,986 actions involved with the ad and a total of 1,553 link clicks. Both men and women were engaged in the video ads, with the most being in the age area of 45 to 65 and plus age range. And then I'll just kind of go over some of these numbers here. So the focus of this campaign was to inform individuals of the importance of getting their regular health screening, specifically with colorectal cancer, because it can save lives. This campaign proved to be a very successful reaching, and one of the numbers that I did mention was 154,304 people in the target audience within the region. So this shows that the culturally reflective content placement strategy proved to be executed well. And the social media buy-in radio summary. So with the Great Plains Tribal Chairman's Health Board, partnered with CAT, like I mentioned earlier, in creating a social and radio distribution strategy to increase awareness and prevention through regular health screening, specifically with colorectal cancer among American Indian population groups within Iowa, Nebraska, North Dakota, and South Dakota. And just to let you know on some of those numbers that we did kind of go over, but on the ad placement details, the channel used Facebook, Instagram, and radio campaign flight March 1st through March 31st. So that's whenever we aired it. And it was throughout the Great Plains region. So the primary target audience was 18 plus. Content promoted for videos, previously procedures with CAT marketing, and then the social campaign results whereas the impressions were 637,804. The people reached was 154,304. Like I mentioned earlier, the link clicks 3,848. Clicks throughout the rate was 24%. Post engagement was 185,738. The video average play time was 6 seconds. The video plays was 460,657. So just to kind of give you an overview on that, um, the social media campaign through with cat marketing went really well. It reached quite a bit of people. A lot of people got to see that type of information. Now, in the upcoming months, if anyone would like any access to this information, if they would like to air some of their type of social media campaign, just feel free to reach out to Great Plains Tribal Chairman's Health Board, more specifically with us, the Great Plains Colorectal Cancer Screening Initiative, and we'll be able to help you out from there. All right, now I'd like to give a shout out, and I think when we have one of our callers on with Jolene Keplin. Now
Yes,
we'll just go ahead and, hey Jolene, how are you?
fine.
Glad to have you on.
Thank you.
All right, so the community of the year, the Turtle Mountain Tribal Health and Indian Health Services. So with this one was with the North Dakota Colorectal Cancer Achievement Awards with the American Cancer Society. Was presented jointly with the Roundtable and the North Dakota Cancer Coalition. With this one, there are many nominations received with partners across the state of North Dakota, making this a competitive process, which went through 2 rounds of review, scoring by a panel of judges, including an out-of-state judges. 3 awards have been selected, and I would like to congratulate the Turtle Mountain Band of Chippewas on their Community of the Year award. And like I mentioned, this community goes above and beyond. So the Turtle Mountain Tribal Health Department collaborated with the local Indian Health Service Unit, Quentin Burdick Memorial Health Care Facility, to increase colorectal cancer screening in their community. Public health nurses, labs, and the Gifford department worked closely with the health educators on the project. They distributed take-home tests, worked together to track returns and results. They made follow-up telephone calls and encouraged community members to return their tests. Since embarking on this project in 2017, they have continued to increase the number of community members screened each year and are exceeding the goals set each year for the project. Their team is committed to saving lives for colorectal cancer through the screening of their community. So I'd like to give it up to Turtle Mountain on their Community of the Year.
Thank you, Eugene.
Jolene,
And
do you have anything to mention? Anything to say?
well, I'm just so proud that we're acknowledged because it is a lot of work. We go set up at the senior up at the casino for our senior day, and we hand out our kits. And let me tell you, when they bring them back here, we're swamped, we're busy, and it's just comments that they tell us, when they did the test, that they were glad they did it, and some had to come in and have more procedure to be done. But it was just the our community members thanking us for being out there and handing out the kits. And I have to mention, this is our second award, so we're doing a good job.
That is right. Yep. And I can't
But
remember the title of the first award that you guys received.
it was it's the same one from
Okay.
Shannon Bacon. Yes, this is our
Yep.
second
Yep.
time we won that.
Yep.
But it was just and it really made our tribal health office feel confident when we read that it our report was reviewed by all those important people.
Mhm.
They picked our tribal health education. That just makes you glad you do your job every day. come to
Definitely,
work and do your job every day. So
for sure.
yes,
I'm glad to work with
thank
you guys. You guys do an awesome job.
yes, you do so much for us also. Thank you
Oh,
for
thank you.
bringing your Roland colon, and
Yeah, for sure.
our people, our natives are visual. So when they see that Roland colon and you explain to them,
Hmm.
that makes it even more educational for them.
Sure.
So thank you.
You're welcome.
Yes.
All right. So next on the agenda, the monthly. Um, so with this one, so the monthly technical assistance correspondence, there was some confusion. So each month we reach out to each tribal subawardee and we go over progress, we go over types of barriers, challenges, and any types of technical assistance that is needed. So the subawardees must meet once a month via conference call. But however, there was a revision because of the COVID-19 outbreak, which is why we created this platform, this sheet that you see on the right. Now, this sheet will kind of go over everything that you need to know within our calls that we do have. Now, it does have every single evidence-based intervention. And on the one that you see is the reducing structural barriers, but there are other ones that are within the document, the worksheet, and those ones would include the client reminders, the provider reminders, and the provider assessments and feedback. Now, depending on what your subaward application is listed, is what you'll click and type in on the EBI, where it says EBI 1, it could be EBI 2, EBI 3, EBI 4. Now, I just want to kind of go over what is written in the application because I think there may be some confusion with some of our subawardees. So just for clarification, under instructions for the application and under subaward reporting requirements, under section 2, subawardees must meet monthly via conference call with their respective GPTCHB patient navigator to discuss program updates and progress. Our monthly call worksheet is a 3-page document, and based on the subaward contract, you will enter information on the 3 EBIs that you have selected within your application. Each EBI will have an area where you can enter information, track progress, challenges on what GPCCSI can do to provide assistance. The last page will include a section for events. We understand that a lot of these communities have canceled events to further stop the spread of COVID-19. If there are other events that are being conducted via web-based, you can enter that information in that section as long as it's providing CRC education. All right, so next on the agenda is the GPCCSI CRC education resources. For programs or organizations looking for printable CRC education materials, we have access to these documents in our website. So during the month of March, we were able to send out new and existing material to our tribal partners. However, at this time, due to COVID-19, it may pose as a risk or challenge in getting these documents sent out through the mail. However, if you would like access to these documents so that you could have in your community, you may do so by accessing the link above or utilizing these steps to access these materials. If you have any questions on any other materials, please feel free to reach out to me or your designated navigator. So like I said, it's on the gptchb.org website. You'll click on programs and services or you'll hover above it, and then from there it'll highlight different types of programs, and you'll click on community health. Now from there it'll bring you to another page where you can highlight or hover above programs, and then you'll see Great Plains Colorectal Cancer Screening Initiative, and then you'll click on there. Then from there you'll be able to see CRC education materials, and we have different types of tabs and platforms on there that you can click on as well. So I just wanted to extend that out to you, just put that on your guys' radar if you guys are looking for CRC education and resources. Or you can click on the link that we have below. So, and like I said, I'll be sending this PowerPoint out to those that would like a copy. I'll go ahead and send it out to the task force. Now we'll go ahead and switch gears and turn it over to Richard and Stella C1 Zimmerman.
Okay, thank you, Eugene.
Me,
I will have Stella. Can you hear me okay?
yeah, I'm gonna see if I can how I can give you the controls here.
Oh, you know what? On the first screen, it's okay because Stella's going to go over the next slide.
Okay, so if you want, just tell me to click, and I'll go ahead and go over that, or I'll just go ahead and click for you.
Okay, thank you. So thanks everybody. So once again, this is Richard Musso, and I'm kind of serving as kind of the data manager role today for GPCCSI, and I guess working with our evaluation team, especially Stella, we were able to kind of modify some different resources and documents that might help to sustain activities in the future. And so I'll let her go over the next slide so she can kind of go over that resource and kind of like where we got it from.
Thank you, Richard. Hi, everyone. I'm actually going to send through the chat a hyperlink to the Sustain tool. And so we have a one-pager. I know that the font is small, but we can follow up with the one-pager that would outline this information a little bit more. But this is a clinical sustainability assessment tool, and this tool is one framework that the GPCCSI staff found as useful tool for clinical assessment of sustainability. So this is just one model that we all reviewed and looked at and examined, and has received a lot of feedback about this tool being useful for clinics. So as you work on your sustainability plan template that Richard's going to go over next, please do not hesitate to contact the GPCCSI staff for technical assistance, and they can connect you with staff and the evaluator to help your clinic. So this CSAT tool is developed by the Center for Public Health System Science at the Brown School at Washington University in St. Louis. What's really neat about this tool is in the graphic in the PowerPoint, there are 7 factors that as you're working through your template, examining these factors that actually influence a clinic's capacity for sustainability. This include how to engage staff and leadership in continuing your EBI efforts, as well as engage stakeholders. Where are we in terms of organizational readiness and outcomes and effectiveness, implementation training, and even workflow integration at the clinical level. And then the last factor is that monitoring and evaluation. Now, when you click on that link in the chat, you're going to be directed to the website there. And this one is if you want to assess where you're at, what might be some areas that are strengths, where are some areas that could be worked on. There's a 35-question self-assessment, and this tool is free to self-assess. And even though it sounds like 35, but it can be completed relatively quickly, like 10 minutes to complete that. And you can complete the assessment as a group or individually. Sometimes clinics assemble as part of their quality improvement teams to do the assessment together. So that could also be one process that your clinic can do. Now, within that website, there is a button called Plan. And when you click on Plan, there's a sample sustainability plan for a clinic. So that is an example that shows what might be some ideas for sustainability as it pertains to, say, implementation training, or what might be some samples under stakeholder engagement or leadership support. So with that, I'm gonna also have one more point about that handout, is that as you work on the sustainability plan template that Richard will show next, you'll notice a section of it is about evaluation. Now, the GPCSI several years ago have developed a evaluation toolkit, and that is also on the website. So I'm going to just copy that and put it in the chat as well. That way, it's a link that directly brings you to the toolkit. So that toolkit presents some ideas on how to evaluate different EBIs. That could be one resource as you're working on your sustainability plan. I think that toolkit, Eugene and Tinka and staff, that was put together maybe about 4 years ago, right? Yep, 4 years ago. So so with that, that's what I have. Richard?
Awesome. Thank you, Stella. Thank you for going over that. So, you know, as Stella mentioned, this is a tool that we've adapted, and this is kind of like its origin and some of the things that, and she kind of went over why we kind of chose it, is because we just felt like it would just fit best with what we were trying to do. So Eugene, do you want to go to the next slide? All right, and so this is our sustainability action plan. There's actually, the first page is actually going to be completely optional. So these are just some of the different things that can be complete. I know it's really small on everybody's screen, so I'm just going to read some of the questions out loud, but it's just ask the question. The first one is, what organizations or individuals need to be involved? What resources will be needed, and how could you obtain these resources? And finally, the last one is, how will you track progress and know you have succeeded? So this one is just kind of optional, mainly due to the fact that it's going to look different for each clinic. But these are fairly simple questions, so they shouldn't be too hard to fill out. Do you want to try the next slide, Eugene? Okay. And then so the next one is this evidence-based intervention provider assessment feedback form. And so what we did was we took all 4 of the different EBIs that each subawardee is trying to implement. And so what we're going to do is we're going to pre-populate these forms with all the information and activities that you're currently doing. So it's actually going to make it a lot easier for you to do this. So so that first column will be completely filled out. So that's the column is activities to achieve the objectives. Then the next 3 columns will be items that you would be working on. So the the next column says who will do the work and when. And then the following column is what are some challenges you might encounter. And finally, what non-financial resources are needed for the step and where will they come from? So these are all different things that, you know, of course, we understand that, you know, since it's a new form and everything, you know, on clarification and how to kind of go about this process, that after they're pre-populated, we'll also, Eugene and Gina will be on their monthly calls going over this with you, so it'll make it a lot easier to fill out these sections. And then also in the bottom part of this, we incorporate a monitoring and evaluation section. So I'm not going to go over each one of these forms, but I am going to mention the one for one that I think a lot of clinics kind of do. So this is just a really brief example and something that would be done. So in the case of doing provider reminders, an example would be that a clinic would continue posting reminders in the EHR system for providers to offer education during communication with clients and patients. The monitoring will be done in the event tab in EHR to understand providers provide this education and just kind of report that information. And another one too that is pretty common that's usually done for client reminders is also the work with scripts and materials for client or/patient reminders and the use of magnets. So like I said, those are typically things that are kind of done to understand how these activities are evaluated. So as I mentioned, what'll be nice is pretty much all the information will be pre-populated, and basically just those 3 columns are information that Eugene and Gina would be assisting you with on your monthly call. So this is pretty much meant for our monthly or for our subawardees, but this is also a tool that could be looked at and adapted with other clinics and facilities that want to implement evidence-based interventions, because we find in this work that even without financial resources, there's still a lot of this work that can also be done. And with that, that's pretty much it. And I really appreciate just being able to go over this. And I guess the last thing I would mention also, as Eugene pulled up this final page, it just gives some basic definitions on some of the verbiage that would be most likely utilized in these forms. So that's pretty much it. Thank you, Eugene.
All right, thanks, Rich. I appreciate it. Yeah, this is something that each navigator will kind of help you out along the way, just so that it's not overwhelming with some of the tasks that you guys have to do or the subawardees have to do in their final report. And we can pre-populate everything for you guys just so that it's pretty much laid out there for you guys to include in your final report. So, but we'll be updating everyone as soon as we can and get these sent out. All right. So next on the agenda is the Regional Partners in Cancer Conference. So we're having this about every spring around May. Now, because of the global pandemic, this is something that's going to be postponed at a later date, depending on how long and whenever the stay at home or quarantine or anything like that is lifted, but it's kind of depending on how things are looking. But it is a 2-day conference in Rapid City where we typically have it, and we have all regional partners, task force members, tribal partners in attendance to share cancer education, cancer data, updates, networking, successes and challenges, and honoring of cancer survivors and patients. So, and I'm pretty sure we did have a lot of people that are on the call attending this event. Now, this is an idea that we are planning on doing, and we're not sure, but we would like some feedback and input on this. Having a virtual via webinar for our cancer conference. And this could be between 2 days and 3-day webinar based conference and 1 hour session per day. Or, we could temporarily postpone it for a later date so that we can meet in person. But this is just some of the ideas that we're throwing on everyone's radar. If this is something that you would like to explore, if this is something that we could provide this platform, this assistance for everyone, having that 2 to 3 day webinar based conference, having a 1 hour session per day, just to cover these types of things, with cancer education, cancer data updates, networking, successes and challenges, and having a little snippet of honoring of cancer survivors and patients. Next on the list would be upcoming webinars. So one that we do have, so GPC, give me 1 second here. I got to clear out of a document here. There we are. So GPCCSI wants to extend to you all a couple of the upcoming webinars we have. We have one coming up from the National Colorectal Cancer Roundtable on May 11th, 2020. The colorectal cancer burden shifting to younger people individuals. So this webinar will provide a close look at the findings from colorectal cancer statistics in 2020, a recent American Cancer Society publication released on March 5th, 2020. According to the report, the burden of colorectal cancer swiftly shifting to younger individuals as incidence increases in young adults and declines in older age groups. Additional report findings include that the median age of diagnosis has dropped from the age of 72 in 2001 to 2002 to an age of 66 during 2005 and 2016. And half of all new diagnoses in people 66 or younger. And then another one that we do have is the prostate cancer survivorship cancer guidelines on May 19th, 2020. So we're gonna they're gonna have an expert presenter, Ted Scolaris, and so these are some of these informations that you guys can click on. Like I said, we're gonna send this out, the webinar to the PowerPoint to everyone. So if you want, you can, and right below each webinar that you see highlighted on here, you'll see a URL website that you can click on. Now that is to register for the webinar. So if you want, we can send this out. You can go ahead and click on that and register from there. All right, so now shifting gears to the 2020 National Colorectal Cancer Awareness Month. Give me 1 second here. So since the year 2000, March has grown to be a rallying point for colon cancer communities where thousands of patients, survivors, caregivers, and advocates throughout the country join to spread colorectal cancer awareness by wearing blue. And fundraising, hosting CRC education events, talking to friends and family about screening, and so much more. Show Your Blue with Great Plains Media campaign. Use the hashtag ShowYourBlueGP on social media to share photos of your support for Colorectal Cancer Awareness Month. Now, the next few slides, I want to show you of all the submissions that we had for our photo contest. Now, typically in the past, we did get quite a bit. We got, up to 15 submissions, but this year, unfortunately, because of the novel COVID-19 virus, that kind of put a halt to everything. So here are our submissions. So we have Acid Inc. I like this one particularly because they are practicing social distancing and working from home and staying safe during this pandemic, but they were still able to take that picture and show their blue. The Lower Brule Sioux Tribe. Now, this picture was before the pandemic was on the rise. So if you see them and they're not social distancing, that's the reason why. And the last one is the Standing Rock Sioux Tribe. Now, they wanted to keep it to a minimum of 10 people within their group, and some of them were practicing the social distancing, like you'll see on the picture on the left. How they have them spread throughout the clinic. So these are some of the photos. Now, Gina Johnson will be sending out a doodle poll. So with the national pandemic, we have like I said, we only had 3 submissions. So you'll see Acid Inc., Lower Brule Sioux Tribe, the Standing Rock Sioux Tribe. So the link will be within the PowerPoint, and we'll also send it out a doodle poll invite via email, and we'll be opening the doodle poll for voting no later than 2 weeks. So at the end of the day on May 6th, we'll be closing the doodle poll for voting. So please go to get your voting in and show the community some love during this pandemic. So now we'll switch it over to anyone have any questions. We'll open the floor up to everyone. Well, if there are no questions, or if you have questions, later that you didn't think of, he's like, oh wait, I should have asked this question during that time, just feel free to reach out to me and I'll be glad to help you out. Like I said, this session is recorded. I will send the link out of the recording session. as well as the PDF version of this PowerPoint. So if you guys do have any questions in regards to this slideshow, just let me know, or you can kind of go over those slides just to kind of touch base on some of the things that you might have missed. So, but I'd like to thank everyone for joining us. You know, like I said, this is the first time we were able to host this from home. A lot of us are working from home, so I like the outcome on how this kind of turned out. So thank you everyone for joining us.